Sometimes parents think that OCD is something that their kids will grow out of. This is a common misperception.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
It's hard to see your kids go through these compulsions and have to do these rituals. And sometimes parents don't want to admit that this is OCD. Sometimes couples will disagree on the severity of the situation. It doesn't help that a lot of times parents and relatives want to also give their opinion and let you know that you're overreacting, or worse, condemn you for your child's bizarre behavior. Some people feel ostracized by their friends or judged by their friends because they just don't get their child's compulsive behavior. OCD can be really confusing to other people. The worst part about it is sometimes even doctors don't understand OCD and will give parents some bad advice, like they're going to grow out of it or that it's hormonal. Unfortunately, all these mixed messages confuse parents and paralyze them and prevent them from being proactive and getting their kids the help that they need. OCD is a debilitating disorder. It can affect kids' grades and their academic functioning. Sometimes teachers, relatives, and friends, and even family members will mislabel OCD compulsions as poor behavior. It's confusing and it's misunderstood by a lot of people. OCD can destroy kids' moods, and you have something called OCD storms, where kids have incredibly big meltdowns caused by the OCD. And a lot of times parents don't know it's caused by the OCD, and they get frustrated with their children. So let's demystify some of the facts about OCD. People do not outgrow OCD. It is not a childhood issue. It is not a developmental stage that you need to wait and see if it will pass. And OCD is not caused by hormones and will not be outgrown once a child passes puberty. Often when I meet kids in my practice, they'll tell me that they didn't realize that other people had the problems that they had, and that they thought that they were crazy. They thought that they were going insane. When kids don't realize that they have OCD, there's a tremendous amount of guilt and shame that go along with it that don't need to. Once kids realize that there's a name for what's been going on with them and that it's a physiological issue, they can be taught to think differently and to outthink the OCD. Research is showing that there is something called neuroplasticity, which shows that through cognitive behavioral therapy and exposure therapy, kids can actually change the biochemistry of their brain, and in such, reduce OCD symptoms, which is amazing.